Confidentiality is a cornerstone of ethical and professional practice in healthcare. It encompasses the obligation to safeguard patient information, ensuring privacy and trust in the patient-provider relationship. For healthcare workers, confidentiality is more than a legal requirement. It is a moral and professional duty that underpins the quality and integrity of care. This discussion will parallel a structured PowerPoint presentation covering the definition, importance, legal frameworks, principles, challenges, and practical strategies related to confidentiality in healthcare. We will discuss the following components of confidentiality in healthcare settings: definition and scope of confidentiality in behavioral healthcare, legal and ethical foundations, the role of confidentiality in building trust, impact of confidentiality on patient outcomes, challenges and risks in maintaining confidentiality, best practices for behavioral healthcare staff, understanding confidentiality. Confidentiality in healthcare refers to the duty to protect patient information from unauthorized disclosure. This obligation applies to all forms of data, including verbal, written, and electronic communication. Key aspects of confidentiality. 1. Definition: ensuring patient information is accessed or shared only for legitimate and authorized purposes. Confidentiality in behavioral health care refers to the ethical, legal, and professional obligation to protect a patient's private information from unauthorized access or disclosure. It involves safeguarding all forms of protected health information, including verbal, written, and electronic communications, to ensure that patients' rights to privacy are upheld. 2. Scope: encompasses medical histories, diagnoses, test results, and personal details like name, address, and insurance information. In behavioral health care, confidentiality is broader and often more sensitive than in other healthcare settings because it involves protecting information that could significantly impact patients' lives, including their relationships, employment, and overall well-being. Here are the primary components. 3. Types of information protected. Confidentiality applies to all forms of information shared or created during treatment, including personal identifiable information (PI), names, addresses, social security numbers, and other identifiers, clinical information, diagnoses, therapy notes, treatment plans and medications, substance use and mental health details, conditions, progress, or setbacks in therapy, which are highly sensitive and often protected by additional laws like 42 CFR Part 2, developmental disability records, information on diagnosis, functional assessments, and individualized service plans. Examples of confidential information are a patient's medical history stored in electronic health records as test results discussed during consultations, contact information shared during hospital registration. Legal and ethical frameworks. Legal and ethical guidelines provide the foundation for confidentiality practices in healthcare settings. HIPAA Health Insurance Portability and Accountability Act. Enacted in 1996, HIPAA establishes national standards for protecting sensitive health information. Key components include Privacy Rule, governs the use and disclosure of patient health information. Security Rule, requires secure storage and transmission of electronic health data. Breach Notification Rule, mandates reporting of data breaches to affected individuals. Confidentiality in behavioral health care is supported by HIPAA Privacy Rule, sets the standard for protecting across healthcare. 42 CFR Part 2, adds extra layers of protection for substance use treatment information. State-specific laws. Some states impose stricter confidentiality requirements, particularly for minors and individuals with disabilities. Check with your state requirements. Ethical guidelines. Professional organizations, for example, HIPAA, NASWA uphold confidentiality as a fundamental aspect of ethical care. Ethical principles. Autonomy. Patients have the right to control who accesses their information. Non-maleficence. Protecting confidentiality prevents harm caused by breaches. Justice ensures equitable treatment by safeguarding all patients' privacy equally. What is the impact of confidentiality on patient outcomes? Confidentiality encourages full disclosure. Patients share critical details for accurate diagnoses and treatment planning. Confidentiality reduces anxiety. Knowing that information is protected helps patients focus on recovery. Confidentiality improves treatment adherence. Patients feel more invested in care when their privacy is respected. Statistically, studies show that trust and confidentiality increases patient retention in behavioral health programs by 30%. What are the principles of confidentiality? The principles of confidentiality guide healthcare workers in their daily practices. 1. Access control. Only authorized personnel should access patient information and only for purposes directly related to patient care. 2. Consent for disclosure. Patients must provide informed consent before their information is shared, except in legally mandated situations. 3. Minimization of data sharing. Disclose only the minimum necessary information required for a specific purpose. 4. Secure communication. Use encrypted emails, secure messaging platforms, and private settings for discussions. What are the challenges in maintaining confidentiality? Maintaining confidentiality is not without challenges, which healthcare workers must navigate carefully. Technological risks. The use of electronic health records and telehealth platforms introduces risks, such as data breaches and cyber attacks. Physical environment, open workspaces, unsecure filing systems. Human error, common mistakes, such as sending emails to the wrong recipient or discussing patient details in public areas, can compromise confidentiality. Balancing privacy and safety. In some cases, such as reporting infectious diseases or suspected abuse, healthcare workers must breach confidentiality to comply with legal requirements. Family and legal pressures. Requests for information from family members or law enforcement. Cultural and language barriers. Misunderstandings about privacy norms across cultures can lead to breaches, emphasizing the need for cultural competence. What are the risks of confidentiality breaches? For patients, emotional harm, stigma, financial loss. For providers, legal penalties, loss of licensure, damaged reputation. For organizations, fines under HIPAA, $100, $50,000 per violation, lawsuits, and loss of patient trust. What are the practical strategies for upholding confidentiality? Healthcare workers can adopt several strategies to ensure confidentiality is upheld in practice. Secure storage and disposal. Keep paper records in locked cabinets. Shred documents that are no longer needed. Use secure servers for storing electronic records. Communication best practices. Avoid discussing patient details in public spaces like elevators or cafeterias. Double-check email recipients before sending sensitive information. Use secure platforms for telehealth consultations. Staff training. Regular training sessions can help healthcare workers stay updated on confidentiality laws, ethical principles, and emerging risks. Monitoring and auditing. Healthcare organizations should regularly audit their confidentiality practices to identify and address vulnerabilities. Handling common scenarios. Scenario 1. Family member requests information. Best practice. Verify patient authorization before sharing any details. Scenario 2. Law enforcement inquiry. Best practice. Require legal documentation, such as a court order, before disclosing information. Scenario 3. Colleague asks for fine. Best practice. Share only if they are directly involved in the patient's care. Let's look at some case studies. Examining real-world scenarios helps illustrate the importance of confidentiality and how to address challenges. Case Study 1. Accidental disclosure. A nurse leaves a patient's file on a shared desk, which is later seen by an unauthorized individual. This breach damages the patient's trust and leads to disciplinary action for the nurse. Lesson learned. securely store all patient information, and ensure it is accessible only to authorized personnel. Case Study 2. Reporting a public health threat. A physician reports a patient with a contagious disease to public health authorities, breaching confidentiality to prevent wider harm. Lesson learned. Understand exceptions to confidentiality, such as legal obligations to protect public safety. What is the role of leadership in confidentiality? Healthcare leaders play a crucial role in fostering a culture of confidentiality. Set the standard. Leaders must emphasize the importance of confidentiality, provide resources, offer tools like privacy screens, encryption software, and secure storage, enforce accountability, address breaches with appropriate corrective actions. Policy development. Leaders must establish clear policies for handling patient information and responding to breaches. Resource allocation. Investing in technology and training demonstrates a commitment to confidentiality. Accountability. Leaders should hold staff accountable for adhering to confidentiality standards, providing feedback and corrective action when necessary. Emerging trends and technologies. Technological advancements and changing healthcare delivery models present new opportunities and challenges for confidentiality. Telehealth. Virtual consultations require secure platforms to protect patient information during online interactions. Artificial intelligence. AI systems analyzing patient data must adhere to confidentiality standards, ensuring algorithms do not inadvertently expose sensitive information. Blockchain for healthcare. Blockchain technology offers secure, decentralized storage of health records, reducing the risk of unauthorized access. In conclusion, confidentiality is a foundational element of healthcare that protects patient trust, ensures compliance with legal and ethical standards, and enhances the quality of care. By understanding the principles, challenges, and strategies associated with confidentiality, healthcare workers can navigate this critical aspect of their profession effectively. Maintaining confidentiality is not only a legal obligation, but also a moral commitment to respecting and protecting the dignity of every patient. Through vigilance, education, and the implementation of best practices, healthcare workers can uphold the highest standards of confidentiality, fostering an environment of trust and professionalism.
Working in aged care.
Privacy and confidentiality.
Today, I learn about how important it is to protect the personal information we hold on clients. Let me show you what I mean.
Can you answer that, Tamika?
Okay, Enid. Hello, this is the Aged Care Centre. How can I help you?
Hello, can I please speak to Auntie Lillian?
Sorry, Lillian doesn't come here anymore.
It's family business. Can you give me a contact number for her?
Yes, okay. I'll see what information we have. Hey, Enid, there's someone here on the phone looking for Lillian. They want to know if we have her phone number. Can you give that to me so I can pass it on?
Who wants the information?
They said they're Lillian's niece.
I'm sorry, but we can't give them any information. They're not on Lillian's consent form as someone we can share her personal information with.
Oh, but they're her family. That's okay, isn't it?
Under the privacy laws, we can't give out personal information. Think about it, Tamika. We don't really know if the person on the phone is Lillian's niece, or even if they are, whether Lillian wants them to know where she is.
Oh, I see. Yes, that makes sense. I'm sorry, I can't give you Lillian's phone number or address because she hasn't given us permission to share with you.
Oh, I see. Well, it's really important, but I guess I'll just have to ask someone else.
Yes, I understand you are her niece, but she hasn't given permission.
That's good. Thanks for the update, Lance. Now, I thought for today's training talk, we could focus on privacy and confidentiality.
I'd like to know more about that. I might have done the wrong thing if you hadn't been there for that phone call yesterday, Enid.
That's right. We have a lot of sensitive information on clients, and we have to protect that information. We also learn things about people while we're caring for them, things that they might not want many other people to know, personal stuff or information that can put them at risk of abuse.
What do you mean?
Well, we have to collect information on people, like where they live, who they live with, and what other support they have. We learn about their health and about what they are good at, what they find hard, what they can't do, and what money they have. We have to do this so that we can give them the right sort of care and services, and also so that we charge them the right amount for that help. That's very personal stuff.
Oh, I see.
We also learn things about people as we work with them. We learn their habits, patterns of what they do, likes and dislikes, and we get to know their limitations or their weaknesses.
Yeah, that's right. We learn more about someone the more we work with them, the more we get to know them.
We need this information. It helps us provide good care, but it also makes the client more at risk of harm if sensitive information is spread around. We need to protect this sensitive information so that the wrong person doesn't hear it and use it against the client. Let me show you what could go wrong. A staff member talking about a client in front of another client.
Did you hear about Betty? She should be getting a payout for that car accident.
I must tell Janice about that.
A staff member passing on information over the phone.
No, her husband passed away last month. She's staying down with her daughter in Adelaide and there's no one to let you into the house.
Good. There shouldn't be anyone at her house then. Easy to break in.
Leaving documents laying around.
That's interesting. I didn't know they had kidney problems.
Leaving the office open and the filing cabinet unlocked.
What are you doing in here? You're not allowed to read that. That's private information.
Accidentally sending information on one client to another person. Accidentally disclosing information.
Hello, this is Betty Sanderson. You've sent me a copy of Betty Smith's care plan. I didn't know she has diabetes.
Disposing of confidential information inappropriately.
I found this client paperwork in the yard.
And it's not just about keeping the paperwork safe. We all use computers so much these days, we have to make sure that we protect the information that is on our computers or stored on the internet. We have to make sure our antivirus is up to date, otherwise our computers could be hacked. And we should use strong passwords on the computer to help protect sensitive information. It's also important that you have passwords on your phone if you have work information, like your roster as well.
That's all really important for us to know. We don't want clients to get hurt because we accidentally shared information about them.
That's right, Samuel. And we have to be careful about what we post on social media. Sometimes we take photos of excursions and we share those on our organisation's Facebook page. But we always make sure that all the clients in the photos have given us permission to use their photos on social media.
So it's okay if I take a photo when we're out and put it on my Facebook page?
That's a good question, Tamika. No, you can't share that photo on your own Facebook page, just the organisation one.
Okay, I'll make sure I remember that.
Good. And don't forget that it's not just private information we have about clients that needs to be protected. We keep information about you as a staff member, and that needs to be protected as well. And there is also information about the organisation that is confidential. So you need to be really careful about what things you talk about and who to. Think carefully before you talk about something or share it on social media.
See, it's really important to protect the information we collect or learn about a client. We need to keep it confidential. This helps keep clients safe and to feel more comfortable about sharing sensitive information with us.
Created by Culturally Directed Care Solutions, supported by the Australian Government, Department of Health and Aged Care.
Work